Hello, welcome. Just waiting for some people to come in before we get started. Today, it's gonna be me and our good friend Marshun coming in just to do live about STIs, myths, facts, everything you want to know. Just gonna wait a few minutes until Marshun gets here, and then until a few other people come. Here he is.
Hi, Brendan.
Hello, Marshun. How you doing today?
I'm doing good. How are you?
I am having a lovely day. I am packing for a camping trip this weekend, so just gonna enjoy the weather while it's here.
Yeah, and it feels really good outside too.
It feels so lovely outside. Like, I usually don't love working from home, but today I'm like, yep, I'm gonna be on my porch all day, like, gonna be outside. It's great.
Are you on your porch now?
No, I was earlier. It's a little loud out
Okay.
there outside, but yes.
Yeah. Okay. Well, that sounds like fun. Make sure you mosquitoes really won't be out, but make sure you bring some off.
I will, definitely. Like, even
Definitely.
when I go outside of my porch, the mosquitoes are still there. They have not gotten October, so
Mm,
sure bring that.
yeah, I hate mosquitoes. Oh my God.
Yeah.
So annoying. Okay, well, I guess we can wait a few more seconds for people to hop on.
Yeah.
It's Friday, lunchtime, so hopefully people are like scrolling through their Instagram, seeing what's going on.
Yeah. Friday, everyone.
Period. Okay. Happy Friday. Yes. Okay, well, I guess we can just dive right on in.
Let's go ahead and get started.
Okay. Well, I'm gonna first introduce myself. So, hi everyone. My name is Marshun. I work here in community health as a community outreach specialist. And I'm joined today by one of my newest faves. Oh, and my pronouns are he and she. I'm joined today by one of my newest faves, and I'll allow him to introduce himself.
My name is Brendan. My pronouns are he, him, his, and I am the, ready for it, social media outreach HIV prevention coordinator. It's a
Oh,
I finally have it. Yeah.
that's an interesting title. Oh my God.
I agree. I like try to say it as fast as possible. Like, let's see, can we get all of the words in?
Okay. Well, as you guys know, during the past few months, Whitman-Walker Health's community health department has expanded its outreach efforts to the social media platform. We cover various topics about HIV, STI sexual health practices, access to care, social determinants of health, and general public health interventions. The next series of outreach sessions will focus on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to educate and support you.
Yeah.
So, like we said, today is Friday, so we just want to keep it light for our viewers, and we're just going to really allow everyone to interact with us today because it's Friday. No one wants to just hear us or hear talking the entire time. So today we're going to actually play a trivia game called, drumroll please, Brendan,
Drum roll.
STI myth versus fact. And like I said, everyone in the comments, feel free to participate. Type in the comments what you think the answer is or how you feel if you have any questions. And just as a reminder, we are offering free HIV and STI testing. If you want to make an appointment, you can call the number we have pinned below. So, I mean, let's go.
Jump in.
Okay, so we already have the questions posted. We do live for that. Okay, so it's gonna just pretty much be a true and false type thing. We're not gonna give you multiple choice so you don't feel like it's too much for you to answer. So our first question today is, can you tell that someone has an STI by looking at them?
Hmm.
So can you just like look at someone outside and be like, oh my God, you have an STI? What do you think, Brendan?
I feel like you can't just because, like, if I look at you, Marshun, like, I don't know what I know. Like, what would make you look different if you had an STI versus not? I don't
Right. Right. It's not like acne where you can just like look at someone and just be like, oh my God, you have acne. So
know.
the answer is actually false. There's no way to know by looking at someone if they have an STI, even if you're up and close and personal with them. The only way to know for sure is by getting tested, which is why we have pinned our comment below because we're offering free testing Monday through Friday. So yeah, the answer is false.
Okay, similar question. If
Okay.
I will I be able to tell? So like, you not might not be able to tell, but will I be able to know I have an STI? True or false?
Um, honestly, the answer is false, but honestly, you kind of tell like you can kind of notice your body is experiencing something like if you have like discharge or something like that, you can kind of tell there's something going on with your body. But I'm gonna say false because, like I said, the only way to really know if you have an STI is by getting tested.
Marshun, you're hired for a reason. You are so smart. Um, yeah, like you were saying, like a lot of times you will know, like a lot of people come into the clinic and like we are able to get them treatment, we're able to get them tested, they're like pretty sure. But a lot of times you can have an STI and not have any symptoms at all.
Right.
Pretty much any STI out there. So the only way to know for sure is to get tested. That's why we offer the HIV STI testing because you don't always know.
Right. And not only do we offer testing, we offer treatment as well. So it's no need to feel pressured or feel like you can't afford it because all our services are free. So well, our HIV and STI testing service is free, and treatment. So yeah. And I feel like we have some comments, Brendan. Let's just kind of see what's going on. What about flies? Do you hate those too? Definitely hate flies as well. Um, what about if you have a sore that is visible? If I have SI, will I be able to tell? Well, yes, if you do have a sore that's visible, although it could possibly be a STI, there's still really no way for you to determine what it is exactly other than getting tested. Just because it could literally be a mosquito bite that you think is an STI, but it's really just a mosquito bite. Um, I guess we can always assume that testing is the only actual way. Yes, testing is the only actual way to determine if you have an STI. True, we can always assume, if we feel like our body is acting weird or responding differently to something, but the only way to know for sure is by getting an STI test. Okay, so speaking of getting tested, of course, and bumps, the best, Brendan, what do you think is the best way for a general, I'm sorry. What is my question? What do you think is the best way for a general herpes test?
For a genital herpes test. Let me think. Well, I know that herpes is kind of like a sore, so I might think something like a culture of uh, a culture of the sores, but it could be a blood test. I'm not sure.
Yes.
What is the answer?
No, no, no. Definitely blood test. Definitely blood test. You are right.
Okay.
But you're not right. I'm just playing. False. The best way for genital herpes test is if when you're having an outbreak, get tested then. The clinician will take a swab of the outbreak and send it to a lab to be tested for herpes. So that is the pretty much the most accurate way to get tested for herpes.
Yeah, I think one reason you want to do like a or a swab is because if you do a blood test, you have no way of knowing where your herpes infection is. You
Right,
genital herpes, it could be oral herpes, it could just be like cold sores and like
right,
millions of problems. If you do the blood test, it doesn't like tell you that much information. Like, it doesn't tell you like where the outbreak's going to be, like how bad it's going to
right,
be. So if you go and you cold, like when the outbreak happens, like that's a way to know for sure like exactly what you're dealing with. So you want to go get tested when there's an outbreak.
right. Just because the outbreak site can actually differ, so it may be in one spot one time and a different spot the next time. So when you are having an outbreak, it's just best to get tested then, just and swap the site. Okie dokie. So, Brandon, do you have any questions for me?
Yeah. So Marshun, true or false, you can get an STI from giving or receiving oral sex.
Um, Definitely true.
Why are you so sure about this one?
I'm so sure just because I know that STIs can be passed through oral sex. So, for example, um, when you perform oral sex on a penis, it's possible to maybe get chlamydia, gonorrhea in the throat. Um, and if you are receiving oral sex, you could possibly get genital herpes, which can be passed from oral herpes, which is commonly called, of course, a cold sore. And other several STIs can be passed orally as well. So of course, we that's why we always suggest using dental dams if you are going to perform oral sex or a condom. So that would be why I'm so sure.
You have all the answers.
It's like I just know the answers automatically.
What? Do you have a question for me?
I do. Let me think of one. Um, so Brendan, once you've been treated and cured of an STI, does it mean you can like never get it ever again? So like if you get treated for herpes or chlamydia and gonorrhea, you'll never get it again once you get that one treatment.
I can see why you would say yes. Like, I don't know. I feel like with COVID, we're talking about like antibodies a lot. And, like, I'm immune. But I do think the answer is false. Like, even if you're cured of an STI, you can get it again, unfortunately.
Yeah, definitely. Um, okay. Yeah, I definitely agree on that. And I used to think growing up that, if you did get an STD and you got treated for it, you were just like immune from it. Like it was like a vaccine or something when really it's just a treatment. So yes, that's the difference. So Brendan, wearing two condoms instead of one provides double the protection against STIs. True or false?
So I feel like more is sometimes better, you know? Like, extra prepared. I want to have as many layers as possible, right? Is that true?
No, it's actually false. We do want layers of protection, which is why we offer dental dams. We offer, I'm not saying we offer, we do like layers of protection, which is why we advocate PrEP, we advocate condoms, dental dams, just because those are your extra layers of protection. Multiple condoms can cause like friction to occur and the condom to break. Um, or tear. So definitely one condom. But of course, if you do engage in maybe inserting it and removing it from the anus or vagina, we do want you to use a different condom just because it's been exposed to the atmosphere. But in that case, four condoms is good, but definitely not stacking four condoms at once.
I don't want, and so I'm gonna put multiple on it. I don't want that.
You definitely don't want to put multiple. You can keep multiple, but definitely don't stack them.
Is there any way to like protect against ripping? Like any tips?
Lubrication. Definitely lubrication. And of course, not stacking the condoms. And also just before you actually take the condom out the wrapper, just maybe like feel it to make sure there aren't any like bubbles or anything, because that bubble can cause a bigger rip, especially because of like friction with the tissues of your body and all of this. So definitely that.
I've heard that, like, water-based and silicone-based lubricants with condoms are going to reduce friction. And then that
Right. Just don't use an oil base with condoms, because that kind of breaks the condom down.
okay, cool. I gotta write that down.
Definitely. I wish we need to pin that. Yes. So Brendan, true or false? To pass along herpes to a sexual partner, one person will need to be having an outbreak. So an outbreak can be like a visible sore or a blister.
Might be a trick question. I feel like, you know, like you get it from the sore, you know? I just am not super sure about when there's not a sore. I might say false. You can pass it along even if there's no sore, because I want to be safe. Is that true? Wait, what's the answer?
Is that false, but is that true? So yes, the answer is definitely false. Herpes can be transmitted even when a person is not having an outbreak. However, transmission is most likely to happen right before an outbreak or when one person is having an outbreak. Sometimes people can tell from certain physical reactions in their body when an outbreak is going to happen, but others cannot predict the outbreaks. It's also possible for a person to transmit the virus when they're not experiencing an outbreak or are not or not about to experience one, but this happens more rarely. So you were right. You can pass it along without having an outbreak, and while having an outbreak. But of course, to get tested to see if you or if you did have herpes, you would, need to be having an outbreak, and get a swab to get the most effective test result.
Good to know. It's like definitely going to happen with the outbreak, but also happen when there's no outbreak.
Right. And you can kind of tell from like your body, kind of like, I don't know, like just from hearing people who do have herpes and what their bodies experience when they're having to outbreak your body, you can kind of almost tell you're about to have an outbreak. So definitely, if you feel as if you may have herpes and you have any type of sores or blisters, go to the doctor and get tested for herpes.
Okay, Marshun, you have been asking me all these questions. I'm going to flip the script. You're the student. Ready?
You said what?
True or false, you catch an STI from a toilet seat? True or false?
Wait, I wasn't ready for that one. Um, True. That's definitely like a common myth, and I've heard that a lot, especially growing up, especially with people saying, don't pee on the toilet seat and all that. I'm like, no. STIs are transmitted through sexual contact, not toilet seats. Even if there's sexual fluids from another person that were on the toilet seat, any bacteria or viruses would not survive on the toilet seat surface for more than a couple of minutes. So you definitely cannot get an STI from a toilet seat.
Very smart. That's correct.
Any more questions?
Just a few, actually. So
Wait, actually, we have a question in the comments.
oh, okay. I have a question. Is syphilis curable? I've heard it's not. Marshun, do you want to take that one?
Yeah, I will. So syphilis is treatable but not curable. You'll always have traces of syphilis in your body. And it kind of I'm freaking what is it's off of RPR tier levels. So depending on your level, you can kind of determine if you've been reinfected with syphilis, but it's definitely not curable but treatable.
Yeah.
So yes. What was your question? Did you ask me the question? Did I interrupt you? I feel like I interrupted you.
It's okay. Yeah. We get to our viewer questions. That's why they're here. We're here for
Definitely. I want to answer it first before they forgot or anything.
Okay, so true or false? Taking a shower or washing yourself with hand sanitizer after sexual contact will avoid STI transmission.
Definitely false. I wouldn't rely on taking a shower to prevent me from any type of infection or to prevent any type of infection. The best way to prevent transmission is, of course, by using like protective barriers like condoms and dental dams, like we said, just because that's the safest way rather than, you can take a shower and get, the lube and stuff off you, but that's just the lube, not the STI.
Yeah. I think for this one, I think the president of South Africa said that you could prevent STIs by taking a shower after sexual contact. That is not.
I've never heard of that.
Or it was like a few years ago. It was pretty wild. But no, do not listen to that. Yeah, taking a shower, washing your hands will do nothing.
No, definitely, definitely false. I wish it was that easy. Then no one would have any type of STI because we could just take a shower right afterwards. Just boom, get rid of it.
Yeah,
um,
is getting nothing off you but dirt.
but the germs. Okay, but the germs. Okay, so I'll ask you our very last question, Brandon. And then also, if anyone has questions in the comments, feel free to ask us. And like we said, if you need testing for HIV and STIs, just call the number we pinned below and book an appointment. So, on this Good Friday evening, Brendan, my very last question during the STI Myth versus Facts series is if two people have HIV and they don't use a condom or any barriers, can they transmit the virus to one another?
This might be not a trick question, but I feel like if they both have HIV, is it just the same virus that if they sex with each other, then they won't be able to transmit it?
You would think so, but technically no. The answer is false because there's multiple strands of HIV. And if two people who are HIV positive have different strands, they can pass their HIV strand along to their other partner, and then they can both have the same strand. But having more than one strand of HIV inside the body can make treatment more difficult and complicated, which is why, if you guys both have HIV, you can pass the other one along. And it can just cause this whole big confusion in your body and to cause complications with your body. So using condoms is definitely the best way to reduce the risk and will also reduce the risk of transmission of STIs that the other person might have as well.
Even if you have HIV, you want to still use.
Right. You always want to be protected just because HIV is just HIV. There's still other STIs that you can contract from not using a condom.
I learned my condoms. Okay, you don't know if you're gonna get it. If it's cool, always use a condom.
Definitely, and remember, we don't stack condoms. We just keep a stack of condoms.
Is more.
Yes.
Unless you're talking about lube.
Yes, and wait, I feel like we just need to. What was our tip again? That we were gonna that we made a tip of. What was it again?
Tip was use water-based and silicone-based lubricant, not oil-based.
Right, because oil-based breaks the condoms down. So those are two things. Don't stack condoms. Keep a stack of condoms, and don't use oil-based lube because it breaks down the condom. So I guess that's it. Do we have any questions in the comments? Aren't there different strands? Yes, there are different strands of HIV. Which is why we still recommend that HIV positive individuals still use condoms because you can pass that strand along to your partner. Showers ain't getting enough. LOL. Okay. Well, I guess that's it for me, Brendan. I hope everyone has a wonderful Friday. I hope everyone is staying safe and washing their hands. And like I said, if you want, I might want to get on profile. Oh, so if you are interested in PrEP, definitely pull up on us. We are offering virtual appointments and in-person appointments. And if you have any questions, you can actually call the number below as well and just talk to whomever answers the phone or have them transfer you to the PrEP clinic.
Yep. So we're here for you.
Absolutely. Let's just see. Okay, I guess we're good now. I guess that's all the questions, Brandon, unless you see something that I missed.
I think they're all. If you have any questions, we're coming back. Like, we're not going away. Let us know. Tune into our Instagram lives. If you need testing PrEP, call the number below. We're here for you.
Yes, and I hope everyone has a wonderful weekend and happy Friday. And Brendan, I hope you enjoy your trip.
Have a wonderful weekend. Tuning in. Bye.
And actually, that's the PrEP clinic number right there. So for anyone who was trying to contact the PrEP clinic number, it's right there. Oh, right there. Okay. So screenshot that, period, and wash your hands. Thank you.
Always.
Okay, well, it's nice talking to you, Brendan. I will TTYL. I'll see you next time.
See ya.
Bye.